Grandiose delusions, otherwise known as delusions of grandeur or expansive delusions, are a type of false belief where individuals believe they are of high importance, extreme wealth, or have immense power. These delusions are common in various psychiatric disorders such as bipolar disorder, schizophrenia, delusional disorder, narcissistic personality disorder, and substance abuse disorders. Primarily having religious, science fiction, or supernatural themes, grandiose delusions are increasingly fantastical, with individuals convinced of having extraordinary statuses or connections, such as being a deity or a famed individual. It is essential to differentiate grandiose delusions from mere grandiosity. The former involves beliefs of imagined grandeur, whether religious, historical, or otherwise, while the latter pertains to feelings of superiority, invincibility, and uniqueness, more akin to self-image and self-regard. Despite the prevalence of grandiose delusions across different psychiatric conditions, there is a significant lack of research in this aspect, especially when compared to other delusions and auditory hallucinations. Interestingly, grandiose delusions can play a positive role in enhancing an individual's self-esteem. This makes it crucial for any therapeutic intervention to carefully consider the potential impacts on the individual's self-esteem before attempting to modify or remove these delusions. Instead of completely eliminating these delusions, it may be more effective to allow for gradual changes, preserving components that are central to the person's self-esteem. In a comprehensive study involving more than 16,000 participants, researchers found that grandiose delusions significantly contributed to individuals' sense of purpose and self-esteem. The narrative focuses on exploring the intense psychological disturbances often experienced by people with schizophrenia and bipolar I disorder, where grandiose delusions are common. These delusions can range from individuals earnestly claiming ownership of prominent businesses and promising substantial financial gifts, to religiocentric self-identifications as prominent religious figures. In some instances, individuals grappling with hypomania or mania as a result of bipolar I disorder can also develop grandiose delusions. This can be further intensified by uncontrolled racing thoughts, auditory hallucinations, and extreme insomnia. The maniac state often evokes heightened emotions and impulsiveness, often fueling their grandiose self-perception. This, in return, can lead to paranoia, extreme irritability, and fear, to the point of suspecting imagined persecution or jealousy from others. However, it is important to state that not all patients with bipolar disorder experience these grandiose illusions. Such conditions typically occur during the heightened mania stage, where patients can cycle through intense emotions ranging from joy to rage. These can also magnify the patient's grandiose self-perceptions, for instance, believing that they are wealthy, famous, or possess supernatural abilities, and in extreme cases, leading to suicidal thoughts. Patients with severe manifestations, historically labeled as megalomania, may start hearing voices that affirm their grand illusions, giving them the belief they have exceptional abilities or are destined for greatness. The current understanding suggests grandiose delusions are often consistent with individuals' exaggerated positive emotional states, alongside certain rational biases. It is traditionally associated with overly high self-esteem, an attribution style that favors the self in the absence of indicators such as depression or anxiety. Recent research has found that repetitive positive self-thinking in individuals without delusions can temporarily incite grandiose ideas of superiority, uniqueness, or importance. Neuroimaging studies have also suggested that such thoughts are linked with increased connectivity between the medial prefrontal and anterior cingulate cortices, which are responsible for processing self-relevant information. This suggests that the grandiose delusions, rather than being a contrast to negative self-evaluation, can indeed offer patients a sense of purpose, uniqueness, and adherence. It provides some constructive meaning to their adverse experiences. Thus, the defensive hypothesis, which is quite similar to the psychodynamic mask model of non-delusional narcissistic grandiosity, is currently lacking in support. The landscape of mental disorders is vast and varied, with many orchestrating a diverse range of delusions. One such type is grandiose delusions, commonly associated with secondary mania, a condition often linked to Parkinson's, Huntington's, and Wilson's diseases. Secondary mania, in turn, can be triggered by specific substances such as L-DOPA and isoniazid, which affect neurotransmitter functioning. Various health conditions, including vitamin B12 deficiency, uremia, hyperthyroidism, and carcinoid syndrome, can also induce secondary mania, subsequently leading to grandiose delusion. The MacArthur, Maudsley assessment of delusions schedule is typically employed to diagnose these. Particular attention is paid to patients with schizophrenia, where grandiose and religious delusions are identified as particularly resistant to cognitive behavioral interventions, a form of psychological therapy used for depression and other mental disorders. Here, grandiose delusions are often connected to core beliefs of patients through inference chaining techniques to aid the patient's recovery, involve zeroing in on particular themes, decoding their unique terminology, and linking disparate thoughts. Interestingly, those with mental disorders experiencing grandiose delusions have shown a lower susceptibility to suicidal thoughts and attempts. Stomp et al. 2006 found grandiosity to be the second most frequent delusion after persecution in a study that spanned 1,000 individuals from diverse backgrounds. There also appeared to be sociocultural influences, with variations noted in the occurrence of grandiosity delusions in schizophrenic patients across different cultures. Studies suggest its prevalence in bipolar patients outranks those with schizophrenia, followed by those with substance misuse disorder and depression. Surprisingly, the age of onset of bipolar disorder and the incidence of grandiose delusions were linked, with higher occurrences among those diagnosed young, 21 or below, than older individuals, 30 or above. The severity of these delusions correlates positively to self-esteem and inversely to depressive symptoms and negative self-perceptions. Gender doesn't play a significant role in the presence of grandiose delusions. However, the content of these delusions may differ across genders. Educational levels seem to bear relevance too, with higher occurrences found among individuals with at least grammar or high school education than those with lower education. In familial terms, those who are eldest are more likely to manifest grandiose delusions compared to their younger siblings.